Please stand to the Pledge of Allegiance. I pledge allegiance.
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Good morning, everyone.
Morning, Mr. Chair.
Good morning, Mr. Chair.
Morning, Mr. Chair.
All right, any additions or deletions to the agenda?
Not this time.
We
Make a
have-
motion to approve, Mr. Chair.
I got a motion, I need a second.
Second.
Any more discussion? If not, those in favor?
Aye.
Aye.
Opposed? Motion carried. Consent agenda, we got a 13 item, 14 items on there. Is there anything that you gentlemen would like to have pulled?
Mr. Chair, I'll make a motion to approve our consent agenda.
All right, I have a motion.
Second.
I got a second. Any more discussion? This will be a roll call. There's no discussion. Commissioner Blaine?
Aye.
Commissioner Jelinski?
Aye.
Casper?
Aye.
Lemire?
Aye.
Myself is aye. Motion carried. All right. We got Public Health Week proclamation.
Morning, Mr. Chair.
Good morning.
Good morning.
Good morning.
Morning, Nate.
We would like to do the proclamation for the annual Public Health Week, which is the first week in April. Whereas the mission of Morrison County Public Health is to enhance the health and well-being of all Morrison County residents and communities by providing quality services that promote healthy behaviors, prevent disease, protect from harm, and assure access to quality health services in collaboration with community partners. And whereas the vision of Morrison County Public Health is to assure that every individual has the opportunity to achieve and maintain an optimal level of health and independence and lead to a vital, productive life. And whereas the Morrison County Board of Commissioners are working toward a community whose citizens reflect physical, emotional, psychological, and social well-being. And whereas the many programs provided by Morrison County Public Health benefit all county residents, whether directly or indirectly, and these programs are essential ingredients of a healthy population. And whereas the Morrison County Public Health Department must continue to reach out to those in our community who seek assistance. And whereas the Morrison County Public Health Department must continue to promote community health and educate residents on the benefits of a healthy lifestyle. And whereas Morrison County Public Health declares to continue to identify local health priorities and implement activities to address the areas of public health responsibility, which include assuring an adequate local public health infrastructure, promoting healthy communities and healthy behaviors, preventing the spread of communicable diseases, protecting against environmental health hazards, preparing and responding to emergencies, and assuring health services. Therefore, be it resolved that Morrison County and the Board of Commissioners does hereby proclaim the first full week of April annually as Public Health Week.
Make a motion to approve, Mr.
I
Chair.
have a motion, I need a second.
I can second that.
And I have a second. Any more discussion?
Mr. Chair?
Commissioner Jelinski?
Thank you. Cindy, Nate, once a year, you just said it, we go through this, if you will, and I don't mean to say go through this, but I'm saying it, go through this. But we go through this as you are here and as the board is here. I hope that none of the board needs to lean on anyone from public health at this time in our lives. I truly do. And that's not what public health is about. Public health is about those that need. And I have to be very careful as I say that because we never know when it could be any of us, when we are in that mode of need, if you will, and find ourselves to the point of we need to lean on somebody and we're going to lean on public health. Thank you for everything that you do, but I just have to keep in my mind, it's not about me. No disrespect, it's not about you.
Correct.
It's about those in need in the county that are still with us here, and we have to continue on. So thank you very much for everything you do.
You're welcome.
Thank you, Commissioner Jelinski. Anything else, gentlemen? Again, people, again, you're behind the scenes, you guys are a lot of times, and it's unseen sometimes, all the work that you do, not just a few of the things that even you mentioned, there's a lot more, I believe, that the public health does, so again, we at the, the board here appreciates everything you do, and I'm sure all the people in the community appreciate it too, so thank you.
You're welcome.
Thank you, guys. Thank you very
So
much.
gentlemen, I got a motion and I got a second. Any more discussion? If not, those in favor?
Aye.
Opposed? Motion carried. Thank you.
Thank you, Cindy. Thank you.
I'm sure we can.
Please.
Cindy likes that.
Right in the middle, Cindy. She's done this before.
Be very, very careful on, with that piece of plastic.
Thank you. Perfect, thank you.
Thank you. Thank you. Good morning.
Have a good day.
Yeah.
Never knew you were a paparazzi.
All that stuff. Well, I think we're right back to health and human nature. You back up in front here? Anyone else? All right.
We are, and good morning again, Mr. Chair and Commissioners.
Good morning.
Morning.
I will let these
Morning.
gentlemen introduce themselves as well.
I am Aaron Stein. I'm the Human Services Supervisor and the Supervisor of the MnChoice Program.
Jeff Bowman, Supervisor, Adult Services.
Morning. Nice seeing you guys.
Yes, good to see you.
Good morning. We're here to talk today about MnChoices and our waiver report. And I just am gonna kick us off a little bit and say historically, these reports have been done separately. And looking at how the service kind of starts and ends, it seemed to make more sense to put them together. That being that the MnChoices assessment really is the entry point and the starting point to getting onto a waivered service. And so we thought it fit better to do them together as you kind of get a whole picture of the service that we're providing. And with that, I will kick it to these gentlemen to take us through the report.
All right.
Have at her.
Have at it. Thank you. Next slide, please. So the first slide here is a summary about what a MnChoice assessment is. MnChoice is, that's the name of the assessment. So it's a standardized assessment that the Department of Human Services has developed, started back in 2014, to essentially to standardize the questions, to ask folks as they're experiencing some difficulties and try to figure out how to get them some help. So the very broad definition, it assesses a person's needs above and beyond what medical assistance or Medicaid would pay for. So there are services that a doctor can order through medical assistance. That does help a lot of folks. Sometimes people need more ongoing support to remain in the community, and that's where this assessment comes into play. And they're also, these assessments are required for individuals to access all waivered services, which is what Jeff is going to talk about in a few minutes. Next slide. So, kind of the current events of the assessment, as I said, it started back in 2014. That's what we call version 1. Now Department of Human Services is rolling out version 2. So this is an updated assessment. There's some drastic changes to how the assessment looks. And we are pretty much right in the middle or just past the middle point of that rolling launch, or that change to version 2. Of note, Department of Human Services is monitoring the engagement, that how many counties and how many workers within the counties are engaging in the version 2 program. Right now, we're able to use version 1 and version 2. And I do want to let you know that Morrison County, compared to other counties of similar size and population, we are at the forefront of that. We've adopted a stance where we weren't going to rush into this, but just gradually engage with version 2, use it, it's here to stay, and our workers are doing it. And a lot of our workers are doing it. So really, when I look at the weekly metrics that the Department of Human Services puts out to the whole state, compared to other counties of similar size, we're at the forefront of that. So I think that was I'm proud of that. So, next slide, please. current staff using the MinChoice version 2 assessment. We have 4 full-time assessors, who completed on average 14 assessments per month in 2023. We also have a new program, 2 part-time intermittent assessors, which I'm gonna talk about in a minute. That started in February of '24. It's been very helpful to regulate the assessment work. Cases remain with assessors until all waiver eligibility is determined and specific programs are chosen by the family and then assigned to a case manager in Jeff's unit. And these assessments are for the over 65 population as well. We have a whole group of care coordinators who are using this assessment to help out that population. Next slide. The impact of the intermittent part-time pool. Prior to initiating the part-time pool in February, the assessors were sometimes seeing 15 to 16 assessments per month. So as a rule of thumb, a new assessment takes about 10 hours to complete. It's an hour to 2 hours of an interview with the person, and then there's a lot of paperwork afterwards. There's a lot of due diligence that needs to happen. DHS guidelines are an assessor should complete 10 to 12 a month. So we were a little off. You know, our assessors, our full-time assessors were handling a lot of workload. We approached the board and we tried this, we're trying this program of an intermittent part-time pool. This has been extremely helpful. When I think about staff retention, it takes a long time to train a MinChoice assessor. They have to know a lot about all the program areas that Human Services has to offer. So, like with anything, staff retention is key, and this is a way to kind of regulate the numbers that the assessors have to do. So the part-timers will step in during months of high assessment activity, and they'll take 2 to 3 assessments. Part of the deal is when we have months where our full-timers can handle the workload, then they won't do any. So having that kind of intermittent part-time pool has been extremely helpful. And I really do anticipate that they'll address the variable assessment numbers through at least mid-24, possibly even throughout the end of the year. So this has been a real key piece to keeping folks engaged, doing their work, but not in a way that they feel like they can't do the work, like it's too much. Next slide, please. And then this is a summary of the waiver programs that are managed by Health and Human Services. So again, you can read it, it's broken up into the over 65 population, has those 3 waivers, and then the disability waivers, which Jeff is gonna talk about, are listed underneath that. There's 4 different waiver areas. And then I'll pass it off to Jeff.
Perfect, yes. As Aaron mentioned, the starting point for disability waiver eligibility begins with a MinChoices assessment. That determines the level of care, meaning if they go above and beyond what state plan services is really designed to support. Also, before a person can move to waiver services, they have to have long-term care medical assistance eligibility, as well as a certificate of disability, either through Social Security or the state medical review team. And we have 4 disability waivers that we work with. CAC, Community Alternative Care, which really is replicating hospital-level care in someone's home. You have a skilled nurse in a person's home rather than being in a hospital 24 hours a day, 7 days a week. We have 2 participants that are accessing CAC waiver, I believe. One of our bigger ones is CADDY, Community Alternatives for Disability Inclusion. Community Access for Disability Inclusion. Again, that is supporting a person's needs that could be mental health, physical health, whatever the situation may be, provides a variety of supports, and we have a vast, I want to say like 150, 160 individuals on the CADDY waiver. Brain injury, again, they have to have a documented brain injury that would qualify them for that disability waiver, and developmental disability. So those are the 4 disability waiver programs that we have. On the next slide, you can see the amount of participants that we have. Now, DHS combines CAC, CADDY, and VI into one program and DD into another. That's why those are broken up into different categories. Also, DHS has DD on a calendar year budget and Caddy BI on a fiscal year budget. So I didn't make the rules, we just follow them. And as you can see, our numbers continue to increase over the years because the needs of our population continue to increase as well. Next slide. Every year, the state allocates a budget to Morrison County recipients. That is designed to meet the needs of the individuals that can cover a variety of services. These services, again, are above and beyond what state plan services are designed to cover. They go from anywhere from home-delivered meals to adult foster care or children's foster care. So it's quite a wide gamut designed to support the needs of whatever they may be. The budget is determined based upon what the state sees, how many dollars is needed based upon the number of participants and what their needs are, and they allocate a budget to us, and we are used as a pass-through for this budget. We are not holding this money, we are just allow providers to access this money through MMIS, which is the billing system that all providers have access to. And if the needs dictate that we can always request more funds. This is not something that is strictly tied to us. Now, again, we are at a state of abundance when it comes to fiscal budgets. That pendulum can swing, and it can swing hard in the future. We just don't know. But right now, if we need more funding to support our individuals, we are able to request that. So the way we are sustaining this program, our case managers bill for their time spent. It's based on 15-minute increments. So whenever they contact a provider, work with the person, do anything to support them, they're able to bill that time. Now, of course, there is unbillable time, such as documentation, travel to and from appointments, and we have about 13 case managers, I would say, within our disability waiver programs. Now, not all of them work exclusively in disability waiver. Some of them work with adult mental health, Rule 185, children's mental health, a variety of other programs. So they're not 100% designated to disability waiver. We have found it very beneficial for our case managers to work in a multitude of different programs. This allows individuals to transfer from one program to the next based on their preferred choice and not having to switch case managers. Because we found relationships that we've created to be most successful in supporting the people that we work with. So final thoughts that we have, as mentioned before, min-choice assessments, that's where it all begins. That helps to determine eligibility for any of our disability waiver programs. They're required on an annual basis for our participants. They are required if individuals if they choose to move into a nursing facility for more than 180 days, then we are required to do a new assessment because their waiver ends. Or if they choose to move out of state, go off of medical assistance. So it's a very fluid system. Whenever there's an update to any of our programs, CMS federal policy is required to give updates and approval. These are all Medicaid, Medicare funds. We have to follow their rules. The state submits proposals, and even though a proposal is approved via legislator, it could take up to a year before that rule becomes policy. Everything needs to be adapted and updated. Right now, we are in the process of Waiver Reimagine. As mentioned, there are 4 disability waiver programs. Years ago, a lot of the available services were designated to certain waivers. Within the past couple of years, the state has broken down some of those barriers and made all services primarily accessible to all waiver programs. Also, they are in the process of moving them from 4 disability waivers to 2. we were supposed to be there, we're not there yet. The state keeps kicking this can down the road, but we get through it as best as we can.
And then I'll just wrap up with some legislative discussions happening down right now at the Capitol. I think, when we look at min choices and that annual requirement being unsustainable to keep moving forward, there is language right now being proposed that would move to a 3-year time frame or as needed, which would greatly help offset the need. On the flip side, in that same bill, there's a hospital emergency admissions min choices part of that, which would require us to do an assessment for someone at the hospital within 7 days. So that again would strap us and put some pressure on us, and so hopefully if one passes, they both pass, and that would probably end up leaving us about where we are now, hopefully, so. And with that, we turn it over to you, commissioners, for questions.
Gentlemen,
Sure.
Commissioner Lemire.
On the one slide that you have, the CAC caddy and the BI waivers.
Yeah.
In 17, compared from 17 to 23, it's more than double.
Yes.
The amount of individuals that you're serving. Is this because of baby boomers? Or not?
You know, I would say that a lot has to do with increased knowledge and willingness to accept available services, as well as to the increased needs that we are experiencing across the county. That would be my guess.
Do you presume that it's gonna continue to climb like that? Or don't wanna say?
I'll jump in a little bit. I mean, I think back in 2017 too, the waiver world was a little bit different. I mean, they handled those budgets a little differently then, and since then, there's been more availability for that budget to help our residents. Do I see that quite rising? I'm assuming as we kind of get into this baby boomer generation and as our population ages, these services are eventually gonna plateau. I would expect that with min choice assessments as well, but in all reality, we're probably looking at a 2030 timeframe before some of that really starts to plateau and come down the other way, would be my assumption. And so I would be hopeful that those numbers hopefully start to level off a little bit, just for capacity's sake.
And the budget for those three, CAC, CADDY, and BI has tripled in the same amount of time.
Yes.
Interesting.
And back in 2017, I'll also start over. The state every year designates so many allocations or available waiver spots to each county. And back in 2016, 15, as an example, DD waiver, we would get one, maybe a year, if we were lucky, which left a lot of our case managers for participants that needed that level of support. This is gonna sound morbid, but if somebody on DD waiver passed away, there would be people waiting for that spot to open up. On an annual basis, we now receive 13 or so DD waiver allocations. So that just demonstrates the needs across the board.
Thank you for that.
Gentlemen, Commissioner Zelinski.
Thank you, Mr. Chair. I have to tell you, folks, I'm pretty passionate about this one. It touches each and every one of us. As most all of you know, that I participate in an organization called Partners for Policy Making, and I do that yearly. And I participate with all of the clients that are there that year. Morrison County's in a pretty dang good place. I'm certainly not gonna get on some kind of a high horse and pretend that all of our clients are happy with our public health, social services, health, and human services department, because I know that's not true. We can't keep everybody happy all of the time, and I understand that very clearly. But I truly believe that we are here and we communicate with our clients. If we can't do whatever it is, we can't achieve X, Y, Z. But we certainly do and can achieve A, B, and C. If we can't achieve anything else, we do whatever it is that we can do. Whether it's personal care, developmental disabilities, or Medicare assistance, not everybody has the information that you have, and I mean that very boldly and with all respect. They don't, so they have to start somewhere. I truly believe that it is with this organization, you, all of you, that without that ability to communicate, which I believe we do a very good job of, we would be falling way short. When I participate with partners in policymaking, I can tell you that there are a lot of issues in a lot of other counties. Not that there aren't any in Morrison County, I want to be very careful with that. And I'm not pointing the finger at anybody else, but there are issues all over, and there is need all over for this. That's really all I've got to say. Just wanted to make that comment. And folks, if there's anyone that you can find that could participate in Partners for Policymaking, I have to tell you, it's a wonderful organization, I think, and gives that information. And I know that in the past, there's been at least one person from Morrison County that has participated, and it was a win-win all the way around. I truly believe that. So anyway, Mr. Chair, thank you. That's all I have.
I'm gonna go follow up a little bit with Commissioner Lemire. With these CAC and CADI and the BI, the numbers have increased over the years, you know, but again, if you look at what the residents of the county, pretty much stagnant, it's even dropping, but yet our numbers are going up. And I just, you know, again, the baby boomers might have something to do with it, but there's gotta be something there we can start looking at. Is it because the qualifications are easier to get on any of these programs? Is it, you know, is it gonna continue to go up while our numbers go down? I mean, the baby boomers, we're only gonna be, you only can put it on us for a few years more, you know, then we're gonna be gone, you know?
I know,
But I'm just, and again, it's just that I think that is something that we gotta really watch, cause even the dollar amounts have gone up tremendously, but yet, you know, our population isn't, you know, so I'm just kinda wondering what's,
And
go
I'll,
ahead.
I'll jump us back quick, Mr. Chair, just to the one thing that Jeff said and how those budgets used to work. You used to get one slot to put somebody on like a DD waiver, for example. So you had that one person in 1 year that could potentially go on to that waiver spot. As the state's changed and services have become more person-centered and personalized, that philosophy has changed a little bit, so the state level has put more dollars into these budgets to support these individuals, which then has allowed us to serve 12 new people in a year as opposed to the one. And so that's part of the reason that this looks like it's just going straight up through the roof. And yes, I anticipate to plateau out, like I said, probably 2030 before we start a downward trend would be my guess. But I'm hoping that it'll start to level out soon to some extent, so. And Jeff, if you have anything else to
yeah,
add, go ahead.
the eligibility criteria continues to remain the same. Not only do we look at available MA-funded services before moving a person to waiver-funded, we also explore informal supports. Community supports, family. We know in the past several years, the availability to those supports has greatly diminished. That the supports individuals had as far as community engagement with the pandemic has really, the challenges it's created has really done away with a lot of those services that, and supports that were not formal, that aren't documented, have really gone by the wayside, it decreased availability, so it's really been a struggle, and that has greatly increased the additional need for individuals.
Let's go one more thing, Mr. Chair.
Commissioner Lemire.
Let's thank you for the presentation today, you guys, and it's nice seeing you. We don't get to see you very
Absolutely.
often, and we appreciate everything you do. And I'm sure we're all happy that the part-time assessors are working out for you.
All right, gentlemen, thank you.
Thank you.
Thank you. Move on.
All right.
Have a great day, guys.
Thank you.
Thank you, guys.
Stay out of the ditch.
Yeah. Keep it between the lines, right?
Yeah, there you go. All right, land services. Good morning, Amy.
Morning, Miss Amy.
Okay, good morning. Amy
Morning, Amy.
Kowalczyk, Land Services Director. I have two things for you today. The first one is to consider the rezone request from Charles and Peggy Seelan. This was a request to rezone their property from rural residential to agriculture. And the purposes were to establish an aquaculture business and an event venue. This was recommended for approval by the Planning Commission.
Mr. Chair, I'll make a motion to approve.
I got a motion, I need a second.
I'll second it for further discussion.
All right, any more discussion, Commissioner Jansky?
Thank you, Mr. Chair. I support this, and I will support this. I just have a question. And I know that there was a little conversation with the Planning Commission in regards to it. Can you please explain a little bit more again on spot zoning?
Yes.
Because there could be an argument made, in fact, there was a little, not really an argument, there was a discussion, maybe that's a better form of saying it. There was a little discussion on, could this be spot zoning? Why is it not spot zoning? Or why is it spot zoning? Or why should it fall through?
Good question. And there was
Thank you.
discussion about whether this amounted to spot zoning. Of course, whenever we have a rezone a rezone request being brought forward by someone, there's a reason why. And the definition of spot zoning is if we are changing the zoning for the convenience of one individual and what they want to do on their property. So I think there's always going to be an element of that to these requests. But whether it amounts to spot zoning is really what is more about what's going on around the area. And with this particular piece, it was right on the line of all ag. So that property was really essentially, everything north had either a commercial zoning district or residential and then into the city of Motley, but everything south was agriculture. So when the Planning Commission was looking at that, a spot zone would be a little bit more glaring, where we may have a piece of property that is completely surrounded by maybe, let's say, rural residential zoning all the way around, several mile radius, and then they're asking for a zoning district different right in the middle. That wasn't the case with this one, and so the Planning Commission concluded that it did not amount to spot zoning because of that.
And thank you. Great explanation. And when you say there was a line, there is actually a
Yes.
line that it's across the line. So, no, excellent explanation. Thank you for that.
You're welcome.
Anything else, gentlemen? I have a motion and a second. Any more discussion? If not, those in favor?
Aye.
Opposed? Motion carried.
Okay, and then, Mr. Chair, I have one other item for you. Sadly, we've received the resignation from Dave Stish from our Planning Commission Board of Adjustment. So what I'm here today is to ask you to accept that resignation and then also to appoint George Sandy to fulfill the remainder of Mr. Stish's term.
All right, gentlemen,
I'll make that motion, Mr. Chair.
I got a motion, I need a second.
Second.
I have a second. Any more discussion?
Mr. Chair, is there actually two items here? Is one going to be a resignation, and is one going to be an appointment? Or are we actually filling this all in one motion?
You can, Mr. Chair, you can do it in one.
Okay.
Mine was a one motion.
Okay, very good.
Mr. Chair,
Go ahead.
just a question, Amy, and these guys are familiar. Can you just tell us who George Sandy is?
Yes, and I'll, thank you for that question, because I should elaborate a little bit more. Because we are on the cusp of an extremely busy public hearing season, Commissioner Winter and I had spoken about the importance of having someone that could hit the ground running a little bit with this appointment. And so George Sandy is a resident of Little Falls Township, and he has served on our Planning Commission before. So he has experience sitting on at least one of these boards, and so the learning curve would not be as steep for him. He also sits on the Little Falls Township Board. And so he does have experience, and he was willing to step in on very short notice and get up to speed. So thank you for that
Very well.
question.
Yes, thank you, Amy.
Mr. Chair,
Thank you, Mr. Chair.
Go ahead.
and just one other piece to Amy's point, to why, she referenced Commissioner Winter in that conversation. The Planning Commission Board of Adjustment is made up of 5 members. Each of those members represents the 5 commissioner districts. Mr. Stish was the representative for District 3, which is Commissioner Winter's district. So the replacement would also come out of District 3, just for
Yes, thank
those
you.
that are listening.
Yes, thank you.
Anything else, gentlemen? And I just want to bring this up, this is something that we didn't take lightly, we had a discussion with Dave over the past couple of weeks, also with George Sandy, and again, I'm hoping that, George will be able to just come in and, you'll bring him up to speed. And
Yes.
go from there, so,
Say something too
go
when
ahead,
you're done.
please.
I just want to say too, if you could reach out to Dave Stish for all of us and thank him
I
for
will.
his many years of service and the knowledge that he has on that board and what he represented. So we
Yes.
appreciate that very much.
Yes, I will.
Yeah, he's been on there 11 years, so, go ahead.
Yeah, Mr. Chair, Amy, I was just gonna say too, that one thing I admire about Dave, he's not just a pushover. He
No.
weighed everything. So he did a great job.
He certainly did.
Thank you.
All right, gentlemen, I got a motion and a second, no more discussion. All those in favor?
Aye.
Opposed? Motion carried.
All right, that's all I have, Mr. Chair. Thank you.
Amy. Have a great day.
Thanks.
Enjoy your day.
Thanks, you too.
Thank you. Keep her between the fences.
Public Works.
Morning, Tony.
Good morning, Mr. Chair. Good morning, Commissioners.
Good morning, Tony.
Tony Hennon, Morrison County Public Works. Mr. Chair, I've got one item for you this morning. Since our past board meeting, we had our final construction side bid letting on March 14th. I'd like to review those abstracts with you. And if you can flip the page here. So this is our pipe contract. This is contract 315 on our CASA 37, which is a box culvert. Our County Road 225, this is 8 pipe replacements. And then our County Road 237, which will be the next one here. And that one's actually 13 pipe replacement and tapers. So a big quantity of pipe work. Some years we do this kind of work internally with our maintenance staff. This year, because of the volume of the work, thought it'd be best to let a contract. If you go to our abstract, we had 2 bidders on this project. Both bidders came in underneath our engineer's estimate. We had an engineer's estimate of just over $1.5 million. And our low bidder actually was Marvin Treader out of Pierce. They came in 23% under at $1,178,187.50. Then our next low bidder, or our second bid, was Hool Excavating here out of Little Falls. So we had 2 local contractors looking at the work, numerous other ones. Both prices came in exceptionally well. One of the things we noticed with this contract is that pipe prices have come down considerably. When we were doing our original engineer's estimate, we didn't have a lot of data on what current pipe was going for. So we used some of our numbers from last year, and we're really happy to see that those pipe prices came in at a considerable reduction from last year. And that's just saying a lot about your pipe manufacturers in the area. They're starting to catch up on some of that backlog that they had seen the previous years. So with that, I'd recommend authorizing to award this contract 315 to Marvin Treader in the amount of $1,178,187.50.
Gentlemen, I'll ask for a motion.
I'd make that motion.
I have a motion, I need a second.
Second.
Any more discussion? This will be a roll call. Commissioner Lemire.
Aye.
Commissioner Jelinski.
Aye.
Commissioner Blaine. Aye. Commissioner Casper.
Aye.
Myself is aye, motion carried.
Mr. Chair, that's my only item unless the board has any other questions.
We're
Thank you,
good.
gentlemen.
Thank you.
It's been a tough one. It's nice for them to get out plowing again, but the warmer pavement temperatures creates kind of a sticky surface there, so. They did pretty good Sunday, the roads looked good. Yesterday was a battle, but by the time they went home, 4:30 yesterday, they were looking pretty good. This morning was tough. I came up one the whole way, and it was tough sledding.
Where did all the work that you guys did on Sunday, what happened yesterday, right?
You know,
It was amazing, huh?
It just didn't want to quit snowing, and then, you know, the wind blowing, that really,
Yeah.
really did a number on it.
Some of
But
it's the shovel too.
But you
Yeah.
guys are doing your job, doing a great job, so.
They're doing a fantastic job. You know, I think they'll be looking for a little reprieve here soon, so,
It's coming, it's coming.
Thank you, Tony.
thank you, everyone.
Thanks
Thank the
for
guys for
advice,
us,
too.
Tony.
Absolutely.
Administration report.
Thank you, Mr. Chair. I have one item, and it's somewhere between housekeeping and some, a bit of some administrative cleanup here. What we have is a resolution that was first brought to the board back in October, 10th of October 2023. And that resolution was for the county and the sponsorship of the Eastern Morrison County Four-Wheeler Club. That resolution passed by the board unanimously, but the last phrase of the final paragraph was that the agreement was to participate in the program for state fiscal year 2024. According to the managers of the program, they need that to say fiscal year 2024 and 2025. So before you today, they do it in the 2-year increments. So before you, I'm asking first for a motion to rescind Resolution 2023-006, which would need a supermajority vote to do so, and then to approve a resolution stated such that it just explained that would capture fiscal year 2024 through 2025, and to do those in 2 separate actions.
Mr. Chair,
Go ahead.
I'll make a motion to rescind the previous motion that was made in October 2023.
Need a
Second.
Any more discussion? Not, those in favor?
Aye.
Opposed? Motion carried. Moving forward, now we need to do the new resolution.
Mr. Chair,
Go ahead.
I'll make a motion to approve the current resolution that states fiscal year 24 through fiscal year 25.
I can second that.
I got a second. Any more discussion? And really, nothing has changed on the resolution other than the time period. Am I correct?
Exactly right, Mr. Chair.
Okay, so we should be good there. No more discussion. All in favor?
Aye.
Opposed? Motion carried.
That's all I have, Mr. Chair.
Is that it?
Yes, Mr. Chair.
Oh, okay, all right, well, administrator report, March 31st to April 13th. March 31st. Okay, I'm gonna start way in the end.
This
Commissioner
time?
Zelinski.
This time? Here we go.
If you don't mind.
Here we go. On Tuesday, April 2nd, at 8:30 in the morning, we'll have a planning meeting right here in the boardroom. And at 6 o'clock that evening, PCBOA should also take place right here in the boardroom. On the 3rd of April should be the very first Morrison County Day with local high schools, I believe. I'm gonna have to look to our administrator. I have no idea when that starts.
Mr. Chair, Commissioner Jelinski is correct, and that is, again, just a quick recap. We've been working on this here for probably 4 or 5 months with the 5 school districts within Morrison County. So Pierce, Upsala, Swanville, Royalton, and Little Falls reached out to the superintendents and the principals of those high schools, and they are all excited to attend our inaugural Morrison County Day here in the Government Center campus. The purpose of that day, or those 2 days, is to bring our high school students here, a small group of them, a small contingent, about 25 per school district. No, excuse me, 50 per school district. And they'll come here and they'll get an overview of what county government is and what county government does, as well as time to spend with most, if not all, of our directors and learn about the professions within county government. So those 2 days are April 3rd and April 4th. They're broken into morning and afternoon sessions. The first session's at 9 o'clock with Piers, and the afternoon starts at 12 with Royalton. And then on the 4th, we've got, again, 9 o'clock, Little Falls and Upsala will be here, and then at 12, Swanville should arrive. So confirmed with all those principals of the high schools and our staff, and we're excited for this event to see how it goes.
Great.
Okay, so thank you, Matt. That's for both the 3rd and the 4th, as Matt said. And on the 4th at 10 o'clock in the morning, I've got a SECB Legislative Committee meeting, and that's virtual. At 3 o'clock that afternoon, on the 4th, I have a Public Safety Communications Conference Advisory Committee meeting. On the 5th at 8:30 in the morning, we've got a planning meeting at Public Works. And at 5 o'clock on the 5th, Morrison County Public Safety Conference will be held at Camp Ripley at the hangar. 5 o'clock on the 5th, and that will be at the hangar at Camp Ripley. Moving right along, on the 8th, 12 o'clock in the afternoon, I have a law library meeting in the law library. On the 9th, at 9 o'clock in the morning, there's a county board meeting right here in the boardroom. On the 10th, at 8:30 in the morning, I believe there's a department head meeting. At 10 o'clock in the morning on Wednesday, the 10th, I'll be speaking at a driver's ed class in Staples, Minnesota. On the 11th, at 10 o'clock in the morning, I have a Central Minnesota Emergency Services Board Next Gen 911 virtual meeting. And on the 12th, at 11 o'clock, that's not correct, that should be 10 o'clock, Central Minnesota RAC meeting, which is also virtual, that's on the 12th. Mr. Chair, that's all I have.
Thank you. Commissioner Casper.
Mr. Chair, Jeff has covered me quite well. The only thing I have is, I'd like to on the 9th, on Tuesday, at 7 o'clock, go to Lee Township, and then at 8 o'clock, go to Morrill Township.
What time are those?
The one is at 7 and one's at 8.
All right, thank you. Commissioner Blaine.
I have nothing.
Commissioner Lemire.
On the 8th, the Yellow Ribbon Committee, Little Falls Legion, 3:30. Got me on the rest.
All right, and for myself, we have our annual meeting, TCC, on the 4th, and that's gonna be at Great River Arts Center at 5:30. And I thought there was one other. No, otherwise, you got us covered, so we should be good, that'll do it. Anything else, gentlemen? I hear none, we'll adjourn at 9:47. Good job.
Thank you, Mr. Chair.
Good job, Mr. Chair.